Thank you very much, Anne-Marie. I was having some audio problems. I trust that it's clear now. Is it?
Very clear. We are
Very
hearing you
All
clear.
right.
loud and clear.
Right. So, um, glad to be part of this particular initiative. And for the record's sake, I probably met Anne-Marie about 8 years ago. I don't know where she got the 40 something, 50. All right. Uh, and so Keith, good to see you, sir. How are you doing?
Oh, I'm good. Thank you very much. And
Good.
especially now that I've seen you here, I'm even better.
All right. And welcome to everybody on the platform. Thanks. And Anne-Marie said we'll be dressing, you use the word all, but it's not all. We'll try to massage as best as possible. So I have been on the road having conversation with parents and teachers about the gender issue. And I'm very intentional in terms of trying to assess what should be the most strategic starting point. And what I have found is that we sometimes respond to questions that nobody asks, or we assume we know what people need to hear. Now, if that is the challenge um, amongst adults, could you imagine what it means to translate ignorance to children? And when I say translate, I'm saying we interpret stuff and then we communicate that without an appreciation of where our children's at. And I would want to posit that our children are powerless and impressionable. So whoever they hear what from, they take it as that. So I want to engage then in some participatory work here as we look at this 21st century climate. And in looking at the 21st century climate, I start with a pre-test or a pre-evaluation. I have 8 pre-evaluation questions, and I'm opening the floor. I'm not going to be commenting on yay, nay, right, wrong. I'm opening the floor. If you don't know, that's fine. You could say that, but I'm opening the floor. Anybody want to take on any one of these questions? Guys, if you don't know, feel free. Don't not say. We have 8
I
pre-evaluation
might
questions.
not, right. I mean, not be 100% correct, but I know in sexuality, education is not just about sex or sexual intercourse, but sexuality as in male and female.
Which question you're responding to?
The first one.
Mm-hmm. And we're not asking what is sexuality. We're asking what is comprehensive sexuality education.
Comprehensive. Yeah, I forgot all that part. Well, I'm thinking the word comprehensive mean well, holistic, maybe what is accurate and factual. That's my fair attempt.
Mm-hmm. Keep it going, people. So I am speaking to the teachers of the students about the gender issues. Hmm.
I'll just volunteer an answer. Comprehensive sexuality education is a system or program of education that is introduced, that has been recently attempted to be introduced into the schools. And it has a very broad agenda, which often is a bit hidden, but it's an education which allows a child to have access to many ungodly kinds of sexual activity from an early age. And it is an agenda of the United Nations and other affiliated organizations to introduce this kind of thinking and change into the minds of young children. It also allows their gender to be fluid, and they encourage gender fluidity and also encourage subtly things like abortion, contraception, use of condoms, and education that is necessarily biblical or necessarily accurate as far as transmission of sexually transmitted infections and things like that. So that's a short definition.
Right. Thank you. Keep it going. Thank you very much. Dr. Primers, good to see you.
Good to see you too, Pastor Don.
All right. I thought I saw a hand that was going up.
Yeah, there was a hand that was raised. I can't remember who had their hand up. Somebody had their hand up.
I think that might have been Lorraine.
Lorraine, yes, Lorraine.
Yes, Lorraine, you can go ahead.
Thanks. Good night. I'm not too sure of the proper definition for the first three. However, from what I would have understood from gender dysphoria, it has to do with the belief that they are born in the wrong body, that the body that they are in does not match up with the way they would want to behave. So, blunt example, I'm a girl, but I'm in a girl's body, but I don't feel like a girl. I act like a boy. I like boy things, whatever that is. I like blue to play with trucks and these things. And these things don't seem to be things that girls do. So therefore, I am in the wrong body. So that's what I would understand as
Thank
gender.
you, Lorraine. Let me roll to the other four because there's a hush in the room. Now, this is the disadvantage of the virtual. When I have people direct, I could watch them in their face.
Okay, I was going to answer the puberty blockers question. Puberty blockers are either drugs or injections or other kinds of surgical therapies that are meant to prevent the child from developing in a normal way as the normal course of the hormonal changes would occur. And so if you are a girl, they may say, well, you remove your breasts or give you injections to prevent your estrogen from developing. Vice versa, in a boy, you could take off the penis, so give them injections to prevent the androgens and hormones from developing. Just briefly.
All right. All right. Now, with the hush in the room, I don't want to assume or read anything into it, but there is a hush. And what I want to establish is that if we are going to speak to our children, engage our parents, engage our teachers, we cannot come from the vantage point of not knowing what are the relevant issues, not just simply going with a Bible and trying to speak the Bible. The Bible must be spoken specifically within the context. And so these are just a few of the important questions that RI teachers should be aware of. And in the light of the pre-evaluation, let me just speak to comprehensive sexuality education. Now, this is a curriculum developed by the United Nations. And it presupposes that it's comprehensive because it seeks to address all aspects of human development, mentally, socially, physically, they leave out spiritually. Okay? And it came out of their own assessment of what is happening globally. Some of the needs of the young people globally, as you would see, emotional, sexual, HIV/AIDS, abortion, adolescents, murdered, suicide, sexual violence. Of course, this may be just above the target group in RI. However, the comprehensive sexuality education curriculum starts at age 3. Okay? There are about 4 age groups that they have targeted in there. So these are the needs. These are the problems they're saying young people are facing. Conflicted messages about sex. Sex is negative. They lack the skills and the information, and so on. So that is a backdrop that which we could identify with. But the rights of the child, in order to push the agenda of comprehensive sexuality education in the schools, they suggest that they are following a rights-based approach, which means then whatever they're introducing in the schools come under human rights. So when parents and teachers object, they basically say you are violating the rights of the child. In fact, in England, one parent sought to take their child out of the school while they were teaching their rights-based agenda, and the government got involved, saying that by taking your child, because some parents choose to go that way. They say, okay, if you're going to do this comprehensive thing, I will take my child out of the school. But by taking your child out of the school, you are now charged with violating. The child has a right to health. The child have a right to family discussion, family planning. The child have a right to be heard. The child have a right for education. The child have a right not to be discriminated against. So Article 29 of the UN Convention of the Rights of the Child means that you must keep your child in school. If you fail to do that, remember it's comprehensive sexuality education. If you fail to do that, then you'll be charged with violating human rights. So that you as RI teachers, if you're going to be thinking of this conversation, all of these decisions are above the children, they're above the school, they're above the principals and so on. But when you go in, then these children are powerless. So one of the questions you have to be asking and answering, what really are the rights of these children? Do these children have any rights? Now, I like Article 2 from this standpoint, the right not to be discriminated against, because part of your work is, if they really want to hold true on not being discriminated against, then shouldn't they allow for the diversity of opinion notwithstanding? So they're introducing this thing of diversity, equity in the schools. And if diversity means different, then there is a place for the Christian perspective and worldview. And if there is no place for that, then you're not being diverse. So we've tried to introduce to the children that they do have rights not to be discriminated against. If they have a right to education, why must the education only be what is coming from the United Nations? If they have a right to be heard, why silence the child if the child has an opinion and they want to express themselves? If they have a right which allow them to make decisions, including family planning, why is it the family planning is only about what the United Nations? So what we're trying to do is to turn this on its head, because that is how the comprehensive sexuality education. Now, just to drill down a little bit here, because remember, you're pulling it down to a smaller group. By and large, there were two major objections to the youth issues. The objections is coming from the United Nations Comprehensive Program. We preach abstinence and we preach children understanding their bodies. Comprehensive sexuality education disagrees. They say abstinence program is not working and it's ineffective, and simply telling children about their reproductive capacity is insufficient because children have more rights than that. So how did they roll out the rights of the child? Remember, this is to be drilled down to the 3-year, 4-year, 5-year-old. They say then, children have rights to be informed about sexuality and their reproductive health. Children have rights for sexual pleasure. Children have rights for sexual fulfillment. Children have rights for sexual pleasure. And children have rights to make their own choices. That is what is stated in the literature. So the whole goal then is to say, if we disagree with abstinence, and if we disagree with just simply talking about the reproductive capacity, what we need to do is empower children and young people so that they could understand their rights as sexual autonomous beings. They have a right to be told what is happening with sexuality. They have a right for their expressions. They have a right for fulfillment, and they have a right for pleasure, and they have a right to make their own choices. What then are some of the essentials located in the CSE? One, they say we have to talk to children and let them understand there's a difference between gender and sex. We have to talk to children to show them what sexual and reproductive health looks like. And what it looks like, we have to teach them how to use condoms. If they get pregnant, how to have a safe abortion. We have to teach them that they have rights as sexual citizenship. In other words, they have a right for their own sexual identities. We have to teach them the right for pleasure. Sex is for enjoyment, safer sex practices and pleasure. So we can teach them about masturbation, love, lust, and relationship. Now, let me give you an example of what happened in the US in 2023. A father went into his child's school and he saw in the library a book teaching children how to safely expose their body parts online. Remember, children have a right for sexual expression, sexual pleasure. So he took this matter to the school board. And if you check it online, Forbes breaking news, they shut down the dad. And they voted 5-2, saying to him that he's lodging his complaint in the wrong place. They never addressed the issue. So they are targeting the children so that they can have freedom of sexual expression. I'll give you a sampling of CSE for the school. Way back in 2000, the family planning of Trinidad and Tobago invited a doctor from Israel, Dr. Broner, and they hosted a seminar. And this is what Dr. Broner says. She argued that we should be introducing outer course in the schools. And that will reduce pregnancy, abortion, and HIV. This hosted by the family planning. Now, she argued that young people don't want to hear about abstinence, but they want to get an alternative option. And she's suggesting if you give them outer course as an option, they will welcome it. What is outer course? It involves masturbation, kissing, petting, oral stimulation, manual stimulation, and genital rubbing. This is what Dr. Bronner suggested as the alternative to help children. And with that in mind, she says teenage pregnancy will drop, and that is what the record is saying. I want to draw a quote of what Dr. Bronner says. Bronner said sex education should start in kindergarten. You have to start sex education programs with children when they're in kindergarten. She said you could probably change the name and call it family life education. So what are we saying? This is part of the comprehensive sexuality education arm of the Family Planning Association of Trinidad and Tobago. And they invited Dr. Bronner to pull teachers together so that teachers will learn about outer course. So if we step back, there is then from the comprehensive sexuality education a UN endorsed agenda to introduce, as far as kindergarten comes straight up, the rights of the child for sexual pleasure, for sexual expression, for sexual information. You as RI teachers, when you go into the school, you're not simply facing that child in the classroom. You are actually facing an agenda by a United Nations. Now, some teachers, they are quiet because they have issues of job security. Some principals are quiet because they are towing the line of the ministries. Now, comprehensive sexuality education is not fully in the school yet. However, they have started in several schools introducing, sensitizing. So there are some, if you look at the revised social studies syllabus at CXC level, they have introduced LGBTQI as part of the curriculum already. Okay, that's already the thing there. Now, Trinidad and Tobago and the region still have a strong religious base. So they are strategically trying to slip the thing in the doors. So you, the RI teachers, one of the things you need to do is to start with the parents. You have to connect with parents and sensitize the parents. Find out, are there any questionnaires your children are asked to fill out? And sometimes a question might just be thrown in there. What do you understand about sex and sexuality? What do you, and they're teasing to see what is the climate. And that is where, because if you go at the children, say, you shouldn't do this and da. What happened? You're being premature in one sense. And the children mightn't be aware of the magnitude of what you are talking about. Now, one of the things we have discovered is that the powers that be, they are assessing to see who say what and which side they fall on. We have to then not respond in a knee-jerk reaction. We need to get the documentation. So if I'm in primary school, a parent says, you know what, they send a questionnaire for my child. Get a copy of that questionnaire. We cannot simply say somebody say and this one say. You have to get the copy of the thing so you can address it. I want to also suggest that if we're doing RI, it have to extend beyond that 45 minutes or hour in the classroom. We have to find some way of getting onto the PTA. Because here it is, you are influencing. Separate policy from children. Once the policy is signed out, the teachers and parents have to quote unquote toe the line. So where we make a difference is at the level of the policy, the decision making. Let me jump over some stuff there. And I want to talk to now a few contemporary. I actually have 20 something. I just pull out a few. And when I talk to teachers and parents, they me know nothing about that. What's it about? But you see, this is the language and the lingo that they are introducing to our children, whether in cartoon form or in secondary level form. Just a few concepts you should get under your belt, right? Gender identity. Now, they have made a distinction that your gender is who you think you are in your mind. So your perception, that's your gender identity. Traditionally, we hold to the view that gender has to do with your physiological appearance. No, that is, so what they're teaching the children is that gender is socially constructed. Gender is your internal perception of who you are. However, your sex assigned at birth or your sexual identity is how you look physically. So you could be male, female, or intersex. And what they have argued, teachers, is that your gender is not the same as your sexual identity. Your sexual orientation is your emotional or romantic or sexual attraction, either to men, women, both genders, neither gender, or another gender. So keep in mind, your sexual orientation is different from your gender identity, is different from your sexual identity. It sounds a little confusing, but that's the reality of the world in which we live. And what they are doing, so when you get to the literature with our children, the books, you have to be spotting these things where they are inserting this concept of gender. So your gender identity is who you think you are in your mind. Your sexual identity is how you look physically, but your sexual orientation is your emotional attraction to whichever gender. So what they're seeking to do is to say to the children from primary school, you have a right to your gender identity. You have a right to your sexual orientation. You have a right to indicate whether you feel comfortable with your sexual identity. Let's go to gender affirming surgery. Now, let's say I'm a male in my sexual identity, but in my mind, I think I'm a female. I have an issue. I am stuck with a penis. So gender affirming, look at what it says, affirming. Gender affirming surgery is a surgical procedure to get your body look like your gender, who you are in your mind. So I'm affirming your gender by surgically altering through hormone treatment or physical Right now, there's a gentleman online, not a child, but he had the surgical procedure. Now he's saying he's missing his penis because he removed his penis, claiming that he was female. Now he wanted detransition. Now he doesn't have a penis. So gender affirming surgery. Gender dysphoria, then, if you notice, is the medical term when there's a mismatch between your assigned sex and your gender identity. Gender dysphoria. Now, you have to understand this within the continuum of mental health, because the book that is used to describe mental health issues, diagnose mental health, it's the Diagnostic Statistical Manual of Mental Health Disorders. It's called the DSM, Diagnostic Statistical Manual of Mental Health Disorders. We are in about DSM 5 or 6 about this time in terms of edition. But up to DSM 3, homosexuality was listed as a mental health disorder. Up to DSM 3, the American Psychiatric Association had homosexuality as a mental health disorder. In 1973, a vote was taken to remove homosexuality. In other words, it was depathologized. And since then, they have been working at new terms to describe what people are experiencing. So this is the current term that is being used in the DSM, gender dysphoria, which basically says then there's nothing wrong with being of a different gender. The problem is you are uncomfortable with it. Understand the difference. Prior to this, it was listed as a mental health disorder, coming down, coming down. However, this new designation says there's nothing wrong with you if you have some kind of it was congruence before, if you have a difference in terms of your discomfort. So the issue with your body and your mind is something you just need to come around to accept, because the issue is really a distress of a reality that you have, but the reality is not the problem. The distress is the problem. So we'll work on you to sort out your distress so you can accept. Herein then, URI teachers, if a child expresses gender dysphoria, they say then you cannot, as religious or RI people, touch that, because nothing is wrong with the child. If the child say, I think I am a girl trapped in a male's body, nothing is wrong with that. Once you try to tell the child something is wrong with that, you are increasing the distress of the child, and it will be deemed then discrimination. So then, some people have described it as an equivalent of being in a place where you know you really don't belong. So there are 3 types of dysphoria that the children will come to. Discomfort with presenting socially as your birth gender. Discomfort with your body being different than your gender. And discomfort with your mind and emotion not lining up with your gender. Now, years ago, they had what is called conversion therapy. Conversion therapy is when a therapist will take a child and work with the child in terms of a heterosexual model of gender and sexuality. However, in the light of dysphoria, not or homosexuality, and is not listed as a mental health disorder, conversion therapy is banned. In fact, it is said it's oppressive, it is abusive, and a therapist in the US and England and Canada will lose their license if someone comes to them and say they are struggling with their gender. What your goal is to help them deal with their distress of not accepting who they are. That's your goal. Your goal is not to try to put heterosexual as the prototype as to how normality is. So puberty blockers then. RI teachers should be aware of that. Now, what has happened is that they have come full circle where they have accepted that once a human being goes through puberty, their physiological characteristics of male or female is set. Remember the swimmer who transitioned from male to female in adulthood and started to swim and beating up everybody in the pool. So he's physiologically male, but in gender, he's female. And then you have Malverne, who go through her or his transition online, 100 days to become a woman. He is physiologically male, but gender female. So what they have decided is that once an athlete goes through puberty, they cannot compete. Let's say male to female. Let's say that male went through puberty. He cannot compete in female sports because physiologically you have been set now as male. So what they've decided to do is through hormonal treatment to our children, inject them through injections and so on, to delay puberty until they decide what is their gender. So lo and behold, and puberty blockers has proven to be irreversible. So some doctors, not Christian doctors, they have been coming out saying you cannot continue puberty blockers. Think of it. Conversion therapy is banned, but puberty blockers, you can go through with it. Gender affirming surgery, you can go